Marijuana is a hot topic these days. More and more states are legalizing it, both for medical and recreational use. This shift has sparked a lot of debate. People are eager to understand the effects of this increasingly popular drug. It's crucial to separate fact from fiction and look at the science behind marijuana use. With so much information circulating, it's easy to feel overwhelmed. Some people swear by its benefits, while others warn of its dangers. Our goal is to provide you with clear, accurate information about the health effects of weed. We'll explore both the potential risks and the possible benefits. Understanding the science behind marijuana is essential for making informed decisions about your health. Whether you're considering using marijuana yourself or simply want to stay informed, knowledge is power. Let's delve into the world of weed and explore its impact on our bodies and minds. When you smoke weed, the effects are almost immediate. One of the most common short-term effects is impaired cognitive function. This means you might have trouble thinking clearly, remembering things, or concentrating. You might also experience a faster heart rate than usual. Another common side effect is red eyes. This happens because marijuana causes blood vessels to dilate, including those in the eyes. You might also find yourself feeling more thirsty than usual, as marijuana can lead to dry mouth. Some people experience paranoia or anxiety after using weed. These short-term effects usually wear off within a few hours. However, the intensity and duration can vary depending on the person, the amount consumed, and the potency of the marijuana. It's important to be aware of these potential effects before using weed. While the short-term effects of weed are temporary, there are also potential long-term risks to consider. One of the most significant concerns is lung damage. Smoking marijuana, like smoking cigarettes, can irritate the lungs and lead to chronic bronchitis. Regular marijuana use has also been linked to an increased risk of mental health problems, particularly in people who are already predisposed to these conditions. Studies have shown a possible connection between marijuana use and an increased risk of developing schizophrenia or psychosis in some individuals. Another major concern is the impact of marijuana on adolescent brain development. The teenage brain is still developing, and marijuana use during this critical period can have lasting consequences. Studies suggest that regular marijuana use during adolescence may impair cognitive development and increase the risk of mental health issues later in life. While there are certainly risks associated with marijuana use, it's also important to acknowledge its potential medical benefits. Marijuana contains compounds called cannabinoids, which have been shown to have therapeutic effects. For example, medical marijuana has been used to treat chronic pain, nausea, and seizures. It's crucial to emphasize that medical marijuana should only be used under the guidance of a qualified healthcare professional. They can assess your individual circumstances, determine if medical marijuana is appropriate for you, and recommend the appropriate dosage and form of administration. Self-treating with marijuana can be dangerous, as the potency and dosage can vary widely. Furthermore, marijuana can interact with other medications, so it's essential to discuss all your medications and health conditions with your doctor before using medical marijuana. Section 5. Navigating the decision. Weighing the pros and cons. As with any decision regarding your health, it's crucial to weigh the pros and cons before using marijuana. On the one hand, marijuana can have negative short-term effects like impaired memory, increased heart rate, and anxiety. Long-term use can potentially lead to lung damage, mental health risks, and developmental issues in adolescence. On the other hand, marijuana has shown promise in treating certain medical conditions, providing relief from chronic pain, nausea, and seizures. It's essential to remember that medical marijuana should always be used under the supervision of a doctor. Ultimately, the decision of whether or not to use marijuana is a personal one. There is no right or wrong answer, and what's right for one person may not be right for another. Factors to consider include your individual health status, family history, and personal beliefs. Section 6. Seeking professional guidance. Your doctor's perspective. If you're considering using marijuana, either for medical or recreational purposes, it's crucial to talk to your doctor. They They can provide personalized advice based on your individual health history and circumstances. Your doctor can also help you weigh the potential risks and benefits. They can also answer any questions you might have about marijuana use, such as potential interactions with other medications or the legal implications in your area. Open communication with your doctor is essential for making informed decisions about your health. Remember, your doctor is there to support you and provide you with the information you need to make the best choices for your well-being. Don't hesitate to reach out to them with any concerns or questions you may have. Section 7. The importance of education, empowering informed choices. In today's world, where information is readily available at our fingertips, it's more important than ever to be discerning consumers of health information. When it comes to marijuana, there's a lot of misinformation circulating, so it's crucial to rely on credible sources. Take the time to educate yourself about the science behind marijuana, its potential risks and benefits, and the legal implications in your area. Understanding the facts will empower you to make informed decisions about your health and well-being. Don't rely solely on anecdotal evidence or information from unreliable sources. Seek out information from reputable organizations like the National Institutes of Health, the Centers for Disease Control and Prevention, or your doctor. Section 8. Your health, your choice. Taking control of your wellness. Ultimately, the decision of whether or not to use marijuana is a personal one. It's your body, your health, and your choice. By educating yourself about the science behind marijuana, seeking professional guidance, and weighing the potential risks and benefits, you can make an informed decision that aligns with your values and priorities. Remember, taking control of your health involves being proactive, seeking knowledge, and making choices that support your overall well-being. If you have questions or concerns about marijuana use, don't hesitate to reach out to your doctor for guidance.